believe it.
Right. So we're trying to do what we can to impact, especially this area.
I think my choice is wise.
The leadership had a choice to even move out with building, but they said we want to stay in the area. So as many partners as we can get, this will be a blessing that we can try to do what we can. We got some absolutely maybe lunch or something. Oh, yeah.
One more cheer.
We're changing up the agenda just this smidge because we have one person who wasn't able to come here. So I think we're ready to get started. I want to thank everybody for being here today. Really appreciate it. It's a very important conversation that we're having, and we have some very distinguished guests amongst us to share their personal stories, and I want to thank all of you very much for being here today. What I'd like to do is to invite our Pastor Brady up to just say a little bit on behalf of New Bethel Community Church, and then we'll transition from there.
Thank you, thank you. Good afternoon, everyone.
Good afternoon.
In a place where everybody can see. And again, I'm Pastor Brady. I'm pastor here at the New Bethel Church, and I'm very glad that we're able to host this particular forum. Our church has been one that has been participating with a number of organizations into trying to provide a connection between those that live specifically in the Wyandotte County and those that have the medical means and the health issues that can answer a lot of the problems that this community is facing. As you know, the statistics tell us that Wyandotte County is one of the worst in the state of Kansas when it comes to medical and health and the people that live in this area. Our church specifically is a holistic ministry. Not only do we deal with the spiritual needs of an individual, but we understand the importance of good health, the body, as well as emotional health, our minds. And what we've tried to do is develop the programming around our church to not just meet the spiritual needs, but also to provide a means by which individuals can understand the importance of good health and good living. Jesus said, I've come that you might have life, but also that you can have it more abundantly. Yeah, you know that word. So while others are achieving abundant living, we want to make sure that the opportunity is given to everybody to enjoy abundant living, especially here in the Wyandotte County where our church is at. I must give kudos to Elder Vonzel Sawyer. He's the president of our Community Development Corporation, and then also Broderick Crawford. I'm sure everybody knows him. He has certainly been an asset. He participates with the Development Corporation and is on staff as well in some capacity to be that connection between us and the community. So I want to welcome you. I'm not here to preach, even though whenever you give a preacher an opportunity to speak, don't put a camera on and a microphone in front of them. But I'm going to have to go out. But I know that this is going to be a wonderful opportunity to share the good results that the KU nursing department has been doing here in the community. And you who are participants, I'm sure you too have been blessed. And I just want to welcome everybody. And whatever we can do in the future, you missed, if you weren't here this past weekend, you missed an outstanding event where we had a community block party, a walk. Over 250 people participated in our walk, and it was just outstanding. But you'll hear more about it. If not from me, believe me, Broderick will let you know. But thank you again so much. And whatever we can do, we've made our facilities available for you.
Yeah, thank you.
Amen.
Thank you.
Thank you, Pastor.
All right, we'll turn it over to Seth.
All right, well, good afternoon, everybody, and thanks so much for coming. My name is Seth Hunter with CCO Communities Creating Opportunity. Just a word about CCO. CCO was founded almost 40 years ago. We founded it almost 40 years ago to address specifically racial redlining and blockbusting in Easter Truce communities. So as a community, from our inception, we've been deeply focused on improving the health of communities and the individuals who reside in those communities. This afternoon is an opportunity for us to hear about an initiative that we've been working on for a few years. It's called the HOME Project, which is an acronym short for Health Opportunity Mapping for Equity, or HOME, as you saw on those signs. Over the last 2 years, we've partnered with the Reach Healthcare Foundation. Dr. Bill Moore, here to my right, has been a core partner on this project, a key advocate within Reach and within the community for our sustained efforts on this project, and so we certainly appreciate your support and your continued support. We've also partnered with the Wyandotte Health Foundation, that's only a few, maybe about a mile or so from here, as well as multiple health centers, Children's Mercy Hospital, Providence Medical Center, University of Kansas Medical Center, that's represented by faculty from the School of Nursing here this afternoon, as well as the Kirwan Institute for Race and Ethnicity out of Ohio State. The goal of the project is, one, to understand where in Wyandotte County do individuals reside who have some of the most significant health needs. And we know that as a county, we have challenges, but we also have opportunities. And so this project was really about identifying the individuals who have significant health needs, and then working with them to identify, to really get a sense of what are those challenges. So we were able to obtain data from the medical center partners, so from Providence Medical Center, from Children's Mercy Hospital, as well as KU. KU is on the leading edge. You guys were in the very early days, you provided that data, which has been great. And through the partnership with Ohio State, we've been able to do the analysis. You can see here on the table this afternoon some of the maps showing the geographies, you know, basically where there are concentrations of high emergency room utilization. And while this is important, you know, as somebody who's a recovering academic, sorry, faculty from KU, Bill might get us on that. I recognize the power and the importance of data. But at the same time, I also recognize the power of story, all right? And while data is important, and while data has a role to play in helping us understand issues that are fairly complicated, we do know that equally as powerful are the human stories and the human experiences, all right? And so today's an opportunity for us to hear some of those stories. Before pivoting to some of our residents and partners, I'd like to just shift to Bill Moore, acknowledge Bill from Reach Healthcare Foundation, because without his support, we simply would not be here, right? This stuff takes funding, it takes support, and so we're very, very interested in the issue, but in order to do that, we certainly have to have financial support. And so I'd like to just acknowledge Bill, Dr. Bill Moore here briefly, just to kind of speak to why the foundation is interested in projects like this, and then just broadly why the foundation is interested in improving the health of communities, the one we're in, as well as communities all across the greater region. Bill Moore.
Thanks, Seth. Well, the Reach Healthcare Foundation has been in existence for about 11 years. And while we're based in Johnson County, we fund in a 6-county region that includes Wyandotte County. Our inception was really the result of a sale of a non-for-profit health system to a for-profit health system. As a result, those assets are really community assets, and 2 foundations were formed out of that pool of assets, and we are charged into perpetuity to invest in these 6 counties, including Wyandotte County. So those are charitable dollars, really, that need to be invested back into the communities in which those hospitals were located. We have a history and a real interest in health equity, and we've worked on a number of different fronts to begin finding strategies and ways to help providers, as well as consumers and organizations, figure out best how to meet the needs of individuals who are living in poverty and who are uninsured and medically underserved. This project really is an attempt to better understand the needs of consumers who are in fact living in most circumstances in highly impoverished circumstances, who don't have the resources often to be able to seek services from clinics or other healthcare providers in large part because of difficulties at accessing those services or paying for those services. And so what we're really interested in here, and the reason we invested in this project, is because we want to better understand the needs in this community, and then find strategies working with our partners in the hospitals and the safety net clinics and community organizing organizations to find strategies that are going to help bridge that gap between the needs that are so evident and the resources that are available. And so we're really interested and excited to be a part of this, along with the Wyandotte Health Foundation and the Kansas Health Foundation that also have funded this work.
And so I think we, at this point, want to do just a quick round robin, just to acknowledge the other individuals at the table. To my left here.
I'm Margaret Bender.
And I'm Jill Pulitzer from KU School of Nursing.
Elaine Frank Raven from the KU School of Nursing.
Tracy Davis.
Robert Crawford, the Community Health Director for the NBC Community Development Corporation.
Janelle Buchanan.
All right, and thank you. And again, obviously, there was lots to say, but I think we're here to listen today. And so at this point, I'd like to pivot to Broderick Crawford from our host institution, kind of lead off the conversation to help us hear from some of our resident partners here at the table this afternoon.
Thank you, Seth, and again, it is a pleasure to take part in this conversation as we look at dealing with the disparities of health in Wyandotte County and the lack of access to affordable health care and why the ED use is so high. As we have completed multiple focus groups now, we have some of the individuals that have participated with us that can share some of the overwhelming stories that we heard. And one of the things that I'll start off that was very amazing is that when we asked the question of many of the participants, what is a safety net clinic? Many of them had no idea even what a safety net clinic is. And so if they don't know what it is, they're certainly not going to know where it is. And so that was very alarming for us as we were doing the focus groups. But again, to listen to the participants, Janelle, why don't you share with us some of the your experiences that you've had in access to health?
I am a home health care provider for 3 different people: my father, mother, and my mother-in-law. And for each one, it's been different cases. For my father, finding him a doctor that he felt comfortable with going to see and not feeling that he was getting secondhand treatment when he went to the offices was difficult. And the first doctor we went to in Wyandotte County, he never wanted to go back. He never wanted to see the facility again. We ended up going outside of Wyandotte County where he was comfortable with the doctor. It was in a different county, but then was referred back to KU Medical Center, which kind of upset him, but he understood why, because of his diagnosis. My father was diagnosed with Parkinson's, and the closest treatment for him was KU. And the doctor there he was okay with, but he was okay but not happy. So he's been able to work with that doctor there in receiving his treatment. But if my father had to go on his own because he's not able to drive anymore, I don't think he would go unless there was a family member with him. And for my father to give up that independence has been very difficult for him. And the same for my mother. She has congestive heart failure. And for her treatment, I'm sorry, she's bedridden right now.
Okay.
For her treatments, for her to get out of the house, I have to make sure, it's easy to guess that I can make sure her doctors are available. If I get a last minute call that the doctor isn't available, which I have gotten, it's very frustrating for her because if her appointment's in the afternoon, I have to start at 10 o'clock preparing her to leave the house. Not something that she can go to at a moment's notice. So if she's canceled, I've got to schedule another 2 weeks out to go to appointments. And then I'd have to travel almost out of Wyandotte County, but close to. And then for my mother-in-law, who just recently received her medical coverage, finding her a doctor that she would be comfortable with seeing. She was supposed to go this morning, but at 8:30 I received a call saying that her doctor was ill, and rather than allow her to see another doctor in that same office, they just rescheduled for another week out for her. And my mother-in-law hasn't seen a doctor in, I've known her 15 years. I have not known her to go to a doctor for just regular medical treatment. She's gone to emergency rooms. But for her to see a regular physician just for a checkup, anything like that, she has not gone because transportation for her is not convenient. If I don't go take her, she's not going. And that would be for any one of her children. She has 8 children. If they can't make it to her, she just will not go. And that's only because transportation is an issue for her, because she doesn't drive anymore. So access for them is difficult, and even for me and my children. My children are covered by the state, and their dental coverage is through the state as well. But if my children need some surgery done on any of their teeth, to have any wisdom teeth pulled, I would have to travel to Lawrence, Kansas for them to receive that treatment. Not something I can do, afford to do, to go from one city to another city for them to have the treatment. Because travel for myself and my husband has been difficult, as my husband's the only income provider for our household of 5. Not something we can afford to do. And trying to find an alternative. I didn't know about any of the safety clinics until I went through the focus groups. And I went home and told my husband, okay, look here, you need to go over here and get this looked at and get this taken care of. Because my husband and I are currently without insurance because I lost my job. I carried insurance for us. And when I lost my job, our insurance left. And even going through the health market to obtain insurance, we had it for maybe 6 months. And that was a struggle for us to maintain and keep insurance. So we had to opt to say, okay, we've got to give up something. If we're going to continue to have a house and provide food and be able to maneuver and take care of everyone. So our health coverage is gone. So my husband and I, we take it day by day and we pray that nothing happens to us. And even though my children are teenagers, it weighs heavy on us because we don't know what's going to happen when we walk out that door. And I can tell you right now, my husband's at work in pain. But he won't admit it, particularly not to me. And I'm his wife, and he won't let me know. But now that I know about the safety clinics, we can better judge and set money aside so that he can get in to see someone. I didn't know those existed. And I've been living in Wyandotte County years, born and raised. I wouldn't know these safety clinics existed. I wouldn't know the urgent care areas existed unless I have driven by there to see them and say, oh, that's there. But then you have to find out, okay, what hours are they in operation? And they're usually closed by the time he gets off work. So for him to go even to an urgent care center, he would have to miss work to go to an urgent care center. And even with the safety clinics, now that we know they exist, we can prearrange so that he can make it to them within the time frame that they're operating. But it's just been overwhelming, and I didn't realize any of this until I was graduated from high school, been on my own, and didn't realize the struggle that my mother and father went through. Even then, when I was in school here in Montgomery County, it's just overwhelming now that I have a family of my own. But we just kind of struggle on a day-to-day basis. You know, okay, you feeling all right today? Yeah, I can make it. You okay? Yeah, I'm gonna make it. But we don't know. We
Thank you.
really don't know.
Thank you, Jeanette. I know that was difficult for you, but we appreciate it.
Did we want to pivot to?
Absolutely. So, Dr. Peltzer or Dr. Frank Reagan, if you guys would be willing to share some of the information and stories that you all received as you were completing the focus groups that took place here.
Okay, we'll try to summarize. So we conducted 9 focus groups and then conducted 2 additional focus groups with the participants from those first 9 focus groups to validate our findings. And from all of the focus groups, we identified 4 major themes. One is that health is resilience to life's challenges or daily challenges. And so within the focus groups, there really was a discussion about how health is viewed as being holistic. So spiritual health, emotional health, and physical health. And that was really important because, particularly for some of our participants, just that stress and each day impacted if someone felt healthy or if their family felt healthy. So that health is resilience to life challenges really exemplified how health was characterized within the focus groups. There was also, and I think Elaine and I had a lot of discussion about this, and she wasn't as surprised as I was, but a lot of discussion in every focus group about how external perceptions of Wyandotte County affect community identity. And so when the participants talked about health and what it means to be healthy and access issues, they talked about their personal health and the health of their family members, but they also talked about the health of the community and how important that was. And that when you look at the other counties in the metropolitan area, and they have the really nice community centers, and they have the Whole Foods, and they have access to quality services that really positively impact health, and that's not present in Wyandotte County, that impacts how members in Wyandotte County feel about themselves and about their community. And that then influences their health. There were also a lot of structural barriers identified that impact health, such as the lack of transportation to go to the clinics, or lack of transportation to go to the grocery stores, because their grocery stores are far and few between in Wyandotte County. Lack of access to quality food, the perception of in some grocery stores that you cannot buy the healthy food that our providers recommend, such as not being able to get turkey sausage. So a lot of access issues, not a lot of opportunity to engage in physical activities. So not having quality community centers or opportunities to go walking. There might not be sidewalks that are safe or walking tracks available. And then lastly, and we heard this in every focus group, that mistrust influences health-seeking behaviors. And I think Janelle really made a good point that particularly if a family had state insurance or some type of public insurance or no insurance, that care received is inferior to someone who has private insurance. And that even within the county, that if you live in the urban core, there is a difference in how you are perceived and how you are treated compared to if you live in western Wyandotte County, and that all then impacts health-seeking decisions. If you don't feel like you can trust your provider, you're not going to go and seek care. So those were the general findings from
Thank you.
our focus group.
Tracy, I noticed as Dr. Peltzer were talking, you shaking your head. Do you want to share with us a little bit about what she was talking about and how that has directly impacted you?
Well, I was shaking my head because I agree with her with knowing, getting the quality health in certain areas. I worked for Sprint for 9 years. I had health insurance and life insurance through them. So I was able to go to the doctor and get my preventive care and I had diabetes and I was able to keep that manageable. But once I was laid off from there and lost the insurance, then I started reaching out to some of the local clinics and was turned away for different reasons. And that kind of put a bad taste in my mouth as far as I had never used the clinics before. And at the time that I need them, I get turned away because I didn't have children, underage children, or wasn't pregnant. And like when I'm 46, I just want to be able to go to the doctor and manage my health issues, and was turned away because of those criteria. So when she was saying that, I'm like, yes, I've been there. I didn't realize it before I got in that situation because I was able to go to the doctor on a regular basis and do my diabetic classes and get my medication on time. And now that I'm in that situation, I can understand what other people have been going through, just trying to deal with certain health issues. So I went to 3 different clinics recently to try to get medical, to see a doctor, to get my medicine, to get it affordable where I can get the insulin. And the first one, I said, no, we don't take overage people. You have to be pregnant or with children. And they sent me somewhere else. And that place told me these are the criteria. You need to prove your income or prove you don't have income. Well, I said, I don't have income, so how do I prove I don't have income? And they told me I have to figure that out on my own. The only way I can prove I don't have income, I'm telling you I don't have a job, I don't have a check stub. I can write you a letter and tell you that I don't have these things, but I can't go somewhere and someone else write that for me. So it turned me right from there.
So to be clear, these were clinics
Yes.
that you had attempted to have access to that were telling you what you needed to do that did not make sense to you.
Yes.
Am I stating that correctly?
Yes. And the last clinic that I did go to, they were very nice. They saw me, they gave me the prescriptions, and I did get some of the prescriptions at a discounted rate. They called them in for me, and then 3 weeks later I got a bill for $300. Well, I can't afford that with no income. So I didn't go back there because I can't keep making those bills if I can't pay the bills. I thought it was going to be a free clinic. That was what the perception was told to me when I went, that I didn't have to worry about it. They made appointments. It took me about 2 or 3 weeks to get in once I did call set the appointment. But they said, oh no, you don't have to have insurance, come on down. But then I got a bill for it.
So Seth, here's something that I want to illustrate. You have an individual who lives in Wyandotte County, and there is a perception that people in Wyandotte County don't want to get the care that they need. You have a person here who has attempted to get care in 3 different instances, 3 different locations, but yet she's not gotten this type of services that individuals in other areas may not receive. And so part of my passion is that people, just because they live in any zip code area, should not warrant the type of care that they receive. Care should be provided for everyone. And part of what we do here with the NBC Community Development Corporation through the Community Health Worker Program is help people to navigate through that process. A lot of times there may be places for people to go that have more receptive receptionists or policies for individuals, but they may not know what they are. I can't tell you the number of people through the focus groups that we've had that have said thank you because we have been able to now link them to the care that they need. But again, it's the perception of Wyandotte County and individuals not wanting to get care. There are individuals who want to take care of their health, but they can't take it if they continue getting locked doors or instances where their access to services is being denied or blocked. So we have one more participant who we've yet to hear from, and this young lady has been a very great participant with us. So share your story with us, if you will.
Okay. My story is a little different, and I'm here to tell it based on why affordable health care matters to me. Several years ago, my husband was diagnosed with COPD, chronic obstructive pulmonary disease. And we were told that the disease would not get better, it would only get worse. He had to retire early due to the illness, and our insurance premium, of course, went up. With frequent doctor's visits, hospital stays, emergency room fees, and mounting cost of medications, we became stressed and found ourselves in a state of desperation. Johnny, my husband, decided to cancel some of his doctor's appointments. He didn't take all of his medications as prescribed to eliminate some of our medical expenses. It was almost as if he was making a choice between life and death. Because a couple of years later, he became very ill. His breathing became so labored, he could hardly move or talk. But he refused to let me take him to emergency room because of the anticipated medical expenses until it became a 911 situation. I watched Johnny gasp for breath, and I couldn't help him, so that was a feeling of helplessness that I had. I watched as the paramedics worked to keep him alive.